Hello everyone, I am Dr. Chinnababu Sunkavalli, Robotic Surgical Oncology in Hyderabad. Today we will be talking about what is the treatment that we have for early stage breast cancer. So how can we treat early breast cancer? The treatment methods are multiple, but if the stage is early, usually you will do well with one modality of treatment. But however, women do get good outcomes with a combination of treatments, may it be surgery or radiotherapy or chemotherapy and hormonal therapy. Number one treatment for early breast cancer could be surgery, wherein you do a breast conservation surgery or a lumpectomy or a wide excision of the tumor, wherein you go wider, take a margin of at least 1 centimeter of the tumor, and instead of removing the entire breast, you can still conserve the breast and do the breast conserving surgery, and we can give good outcomes to the patient in terms of not only the survival but also the cosmetic outcomes. So that is the surgical treatment, and some women get mastectomy, what we call as total removal of the breast. So that is usually done in a little bit advanced stage than a very early stage, so where the whole breast is removed. So in any case, also intend to do something called as the lymph node staging, wherein the sentinel lymph node biopsy is done, or sometimes you take a few nodes and send them for testing to know the exact status of the lymph nodes in the armpit. The second modality of treatment for breast cancer early stage is radiotherapy at some point of time, because any breast conserving surgery is usually followed by radiotherapy, especially after lumpectomy. Chemotherapy after surgery usually lowers the risk of cancer coming back again. So the drugs attack the cancer cells. Even if whole tumor is removed, the micrometastasis, a few cells which are circulating in the body, can be attacked with the chemotherapy. So those women who have a larger tumors removed are more likely to get chemotherapy, and those with the smaller tumors and those who are affected with the hormones in the body, wherein we call as hormone receptor positive cancer, in those people chemotherapy can also be avoided sometimes. So the next modality of treatment after surgery, radiotherapy and chemotherapy is hormonal therapy, especially those who express some hormone receptors called estrogen receptor or progesterone receptor. There is also something called as targeted therapy for breast cancer, wherein some tumors express excessive amount of protein called HER2/neu. So if there is more expression of this molecule, then there is a specific targeted therapy available for this kind of a tumors, and this drug also helps in the better effectiveness of the chemotherapy as well. So the treatment for early breast cancer could be a combination of surgery, radiotherapy, chemotherapy, hormone therapy and targeted therapy. Thank you so much for watching this video.